Hi, welcome back to the Diaries. It's Crystal here with you, and today's video is for anyone who is having an endometriosis surgery. So the only way currently, well actually, I believe they've come out with a blood test now, or they're working on a blood test to be able to help diagnose endometriosis. But so far, up until this point, the only way to officially diagnose endo is by laparoscopic surgery, by actually opening someone up and going in and finding what you can find. So it's a very common thing to have a laparoscopy if you have endometriosis or you think you may have endometriosis. A surgeon might choose to operate on you. And I am a veteran. I've had multiple surgeries. Actually, in my lifetime, I've had, I think I worked out I've had about 10 different surgeries, and at least 5 of those now have been laparoscopic endometriosis excision surgeries. So the one I'm recovering from right now, I just had my left ovary removed, my left fallopian tube and my appendix, and there was a lot of endo scarring and lesions in there because I have stage 4 endo and I was diagnosed with that 11 years ago. So it's been a journey. So there was a lot of trying to pull all that kind of stuff out. My surgeon found a polyp there as well. My surgeon is an expert in endometriosis surgery. I'm very lucky. He's brilliant. And he said he was shocked by the redness, the inflammation, the angriness of my endo, which is, you know, I feel like it's kind of impressive if I can shock an expert. But honestly, there are people who are far worse off than me. Anyway, let's dive into this list of things that I think might be useful for you if you are having an excision surgery, just to have a little think about. Hopefully these tips can make your surgical experience a little easier. Some of these will also apply even if it's not an endometriosis surgery that you're having. Yeah, just keep that in mind. All right, so I do have some notes in front of me. I have also, years ago, I made a video on things to pack if you're going to hospital for endo surgery, so you may want to check that video out. I still stand by the things that I put in that video, but I want to also talk about some things that you should be doing before you go in to hospital. Obviously, make sure that you have someone that can look after you for at least the first 48 hours when you come out of hospital, because you are going to be groggy, depending on, it depends on how long you stay in there. I've stayed in there for up to 5 nights in the past. And so obviously when I came out of hospital, I wasn't so groggy anymore, although I was on pretty strong pain meds still, which did make me a little bit drowsy. But if you are just in and out, then you are going to be very, very groggy and you're going to probably have a hard time moving around. So it's definitely important to have someone that can stay with you and look after you and just basically give you all the love and attention and help that you need in the 48 hours after surgery. It's also a really good idea to, this sounds really boring, but like wash all your bedding, get some clean sheets on the bed, make it nice and fresh for you when you get home to get into, because also you're probably not going to feel up to changing those sheets, or you're not even going to be able to. You're not allowed to do any like housework for at least the first week after your excision surgery, and depending on how extensive it is and what you have removed, then these things can be longer. But definitely I think you should have clean sheets. I definitely recommend doing loads of washing before you have your surgery. So basically when you come out, you don't have to worry about anything for a while. Everything is just good to go. Also, prior to your surgery, I definitely recommend either like pre-cooking meals and freezing them, or make sure you've ordered a delivery of meals to come when you're home from hospital. It's a little bit tricky though, because you might not know when you're coming home. So the easiest thing to do is to have a bunch of meals and freeze them for when you come out of hospital, because you will not feel like cooking. In fact, you will probably barely feel like eating. If you're anything like me, I have to force myself to eat. Not a huge amount, but I try and force myself to get into some sort of eating routine to try and remind my body how it's supposed to work. But definitely make sure that you have things available to you that you can just pull out of the freezer and heat up, because the effort of actually having to cook something if you're already feeling nausea is like, I'm just not going to eat. So that is something that I think is super, super important. Also, before I go into surgery, I get my roots done. I got my nails done. I know, it's like I'm going on a glamorous holiday. But no, the only reason I get my nails done, like I have them done super, super short, is because ever since I was a small child, I pick my cuticles to the point where they will gush blood and my fingers will be a bloody mess. And for some reason, it is a habit that I've never been able to break. So that is why I get my nails done. Just like get your hair or like, you know, wash your hair, whatever you need to do before you go into hospital, because again, you are not going to have the energy to even think about that for a little while afterwards. So highly recommend. I actually was really lucky because I have a beautiful hairdresser who lives literally a minute drive from my house, and I went in there just the other day and she washed my hair because I just didn't have the energy to wash it myself. It's long, it's thick, it knots like a mofo. So yeah, I was just like, yes, please wash my hair. And yeah, that was great. So your hairdresser might even do that. It can be pretty cheap as well, depending on where you go and if it's convenient. Mine charges $10, but they actually gave it to me for free. So thank you so much, Lady and the Man Salon. Okay, now let's talk about something really sexy. Bowel prep. I don't think even saying it in a sexy way does anything to sexify it. We are going to talk about bowel prep because it is a necessary part of having a surgery, a laparoscopic surgery. So you will probably be on a clear fluids diet for the day before your surgery. And as much as it sounds like a good time eating jelly with jelly babies inside it for breakfast, lunch, and dinner, it's not all it's cracked up to be. I never want to see jelly or jelly babies ever again. Every time I do bowel prep, I'm like, oh, keep them away from me for like another 3,000 years, thanks. But what I will say is definitely make sure you have different types of fluid for your clear fluid day, because you will need something other than just water, because you will need the hydrolytes, you will need minerals coming into your body. And also you will probably just get sick of one type of fluid. So it's really good to have a mix of different fluids. Even for me, like I don't normally drink any soft drink or anything like that, but I had ginger beer because I was allowed to have soft drink. So I had ginger beer on hand. I had sparkling apple juice with no pulp. You can't have any pulp in anything. And yeah, just make sure I have a variety whenever I do bowel prep. So I definitely recommend that, because you will get so sick. You'll get so sick so quickly of the things that you're having, I promise you. Okay, let's talk about leaving the hospital. So it's a really good idea to make sure that you have a pillow. Whoever is picking you up, make sure that you have a pillow so that you can prop it between yourself and your seatbelt, because you are going to be sore and you are going to be swollen. Having a pillow to get you home will save your life. Also, if you're anything like me, make sure you have a vomit bag because it can be a lot of effort going from, especially if you're being kicked out of hospital quickly, if you're going from having the surgery to suddenly like the effort of getting out of the hospital, getting into your car and getting home. Like obviously you're not driving, your person that you have look after you for the next 48 hours will be driving, but it's a lot of effort and it may make you feel quite queasy and quite sick. So it's definitely worth just having a little vom bag handy if you have a tendency for nausea, which I do. I also make sure I have some peppermint everywhere. I carry peppermint oil in my handbag just because it helps me so much just to inhale that if I'm feeling sick, but that's just me. Okay, so when you get home from hospital as well, man, I had like 78,000 pillows in my bed to try and get comfortable. So I definitely recommend having a bunch of different size and types of pillows available to you so that you can find a position that works for you to be able to rest and to sleep. After one of my previous surgeries, I had one of those boyfriend style pillows, the ones that with the back and the arms that just sit on your bed. And I slept upright on that for, I reckon like a month, maybe nearly 2 months. But this time around, that wasn't comfortable for me. So I ended up just getting like a ton of pillows on each side of me and making pillow walls and sleeping like that. So it just depends where you're being operated on, what they do, as to how you feel afterwards and how you're gonna get comfy. But just, I think having options is really important, because you're just getting comfortable is probably one of the biggest challenges. And obviously you want to get rest, but if you're not comfortable, you can't get rest. So keep that in mind. Now, check with your doctor first, but I like to get onto a probiotic as soon as I get home from hospital, pretty much, because I'm putting so many meds in my body. I want to give my natural microbiome a bit of a chance, a fighting chance. So I get straight onto the probiotics when I get home so that I can try and start rebalancing my gut health. But again, you should check with your doctor before you start any anything. Now, you're also not going to be able to wear tampons for a while. This can vary, like the exact time frame. Your doctor might have a different time frame to someone else's doctor, but standard, you're not going to be able to wear tampons for probably a couple of weeks. So it's definitely a great idea to have period underwear. Period underwear is a revelation. I wish it was around when I was in high school because it would have changed my life. But anyway, and you can use pads if you want to in normal underwear, but man, I love my period undies for after hospital because it's just, I don't have to think about anything. I just pull them on and I'm covered. I'm good to go. I actually get, mine are like the Love Luna ones, and they're like shorts, long shorts with period stuff in them because I just find them the most comfortable because normal ones just right up my butt. I have a butt that eats underwear, which is, it's a hungry butt, okay? It just is. So that's why I find the long shorts better and more comfortable. But I definitely recommend having a couple of pairs of period undies for after your surgery because you will be bleeding for a little bit. Make sure you have comfy clothes. So it sounds ridiculous, but I like to schedule my surgeries when possible in the warmer months of the year, because that way it means that when I'm healing from the surgery and my stomach is swollen, which it usually is on me personally for a couple of months, it means that I can just get around in flowy dresses. I don't have to deal with waistbands. Waistbands, pants are the enemy. For me personally. And honestly, just with endo, pants tend to be the enemy because my stomach gets so inflamed I look like I'm having triplets, and then pants just feel uncomfortable and tight and I feel like they look bad. So if you can wear long dresses or whatever's comfy, I definitely recommend that. If it is winter, you may need to obviously wear pants. So I would suggest buying a couple of pair of very loose, comfortable pants, maybe with a drawstring, and size up because your swelling will make you basically a size bigger. So it's definitely important to have loose, comfortable clothing. I love a t-shirt dress because they just look funky, but they're so comfy. I travel in them a lot as well for the exact same reason. But yes, comfy clothing is so, so important. So important. Okay, now it's really important as well, if you feel like you're not healing in the way that you're supposed to contact your surgeon's office. I had a really bad experience. In fact, my first laparoscopy that I had, which was before I was diagnosed with endo, and this guy he didn't even diagnose me. Anyway, let's not get into the story of how neglectful that gynecologist was, because it's a whole other story. But let's just say I had a surgery to remove a cyst, which wasn't effective, couldn't be done because I had too much scar tissue. So he just stitched me up again and sent me off. And I was not getting better. And I was told I should be better in a few days. You'll be fine in a few days. Anyway, I was getting sicker and sicker and in more and more pain, to the point where if I were to sneeze, the pain, I felt like it was going to kill me. It was, I couldn't even move. And I was getting really sick. And I got to the point where I started to have like fever, and I was getting, the like cold sweats and the goosebumps, all that stuff was happening. So in the meantime, my mum had contacted my surgeon's office and he had said, no, she'll be fine. There's nothing, don't worry about it. And my mum was like, I want to bring her in. Anyway, it got to the point on Christmas Eve when my mum was like, I am bringing her to see you. And she did. She dragged me in there, and he took one look at my stomach and was like, oh, Scheißen. I had developed an abscess this big. So it's like a ball of like infection and pus under the stitches in my stomach where I'd had the laparoscopy. And so that was poisoning my bloodstream, and that's why I was getting sicker and sicker. So anyway, he was like, oh, you need to go straight to emergency. So Christmas Eve, I'm there in emergency having an abscess drained. And then, this is so gross. If you're not cool with grossness, just like switch those ears off for a minute. But it was like 2 a.m. Christmas morning, and the rest of the abscess just started oozing. And so my parents were literally there with towels, like soaking up this abscess pus that's coming. It's disgusting. It's so disgusting. Anyway, the point is, not to gross you out. But the point is, if you know that there is something wrong, then you make them damn well listen, whatever it takes. You go in there if you have to, but make sure that you get seen, because I would have ended up in emergency anyway if my mum hadn't taken me to see him and he decided that I needed to go to emergency, because that thing was gonna poison me. So it's very, very important to feel like you can speak with these people if you are not getting better. And that's also like a reason why, like, I have the surgeon that I have now, because he's brilliant. I feel like I can ask him anything, and yeah, it's important to have that kind of relationship. But back yourself. You know your body better than anyone else does. That being said, make sure you give yourself time to recover and the patience to recover, because this is one thing I've definitely learned along the way, is that healing is not a linear process. You want to be like, I'm getting better and better and better and better and better and better, and better until I'm perfect. But actually it's more like, oh, I feel a little bit better. Oh, I feel a bit crap. Oh, it's that kind of situation until eventually you feel good again. So try and be patient. And this is honestly my biggest weakness. I'm terrible at being patient with myself. I've never been good at sitting still. I've never been good at doing nothing, because I feel like my brain is my own worst enemy and it goes into like hyperdrive. But just try and be patient with yourself. Make sure you save maybe some like movies that you really want to see for after surgery as kind of a reward and a gift. And yeah, just try and lean into that healing and recovery time, because your body will thank you for it. Also, make sure that you have adequate pain medication, because they have learnt that you have better outcomes when you are not dealing with obviously incredible amount of pain. So you are going to heal better if you're not in excruciating pain and feeling stressed about the pain, because then that pumps up the cortisol levels and it's just a vicious circle. So yeah, make sure you do have adequate pain medication. Don't be a hero, which is something that I have definitely, I think because I've had to have so much medication throughout my life for my migraines, blood pressure, endometriosis, adenomyosis, all of these things, I kind of try and like get by on the bare minimum. But I have realized more recently that I just need to do what I need to do to be comfortable, because then it helps my body in the long run. Yes, so try and just look after yourself, okay? All right, let me just check. I think that was pretty much most of the tips that I wanted to give you. One last thing that's very important to keep in mind is that it is quite common to have bouts of depression or sadness when you are recovering from a surgery. And I don't really know why it happens, but I mean, it's probably a combination of a whole bunch of things, you know, like depending on if you had organs removed, or maybe you've been diagnosed with endo. When I was diagnosed, it felt completely bittersweet, because I felt justified in knowing, especially because it was such a severe case, that I wasn't crazy when all those people told me to be tougher. But on the flip side of that was, oh, but there isn't a cure. So I understand that that can be a very bittersweet occasion. Maybe you are off work, maybe you've had to quit your job to have your surgery, and so there's that whole, oh my gosh, what's my future look like? There are a lot of reasons. Pain, of course, lack of sleep, many reasons why you can feel this way after a surgery. So please get the support that you need. If you need to see a counselor, you can. There are online counselors, so you don't even have to, if you're in pain and you're still healing and you're not up to leaving the house, you can talk to someone virtually, online, over the internet. Please don't be afraid to reach out for help. I am on antidepressants, which I have been on for a couple of years. I've been on and off them throughout my life, but I have to say that I have been much more of an even keel after this surgery, because I've had that buffer, whereas I didn't have that last time. And that's actually what I ended up being on antidepressants. I'm not saying you need to be on antidepressants by any stretch of the imagination. All I'm saying is don't be afraid to reach out for help if you are struggling with depression, sadness after your surgery. To some extent, it's completely normal, but if you feel like it's getting to the point where it is unmanageable for you, please reach out. and know that you are not alone and you are not the first person to experience that either. All that being said, look, please, if I can help you in any way, if you have any questions, feel free to reach out to me. I am not an expert, but I know what I know from my own experience over the last decade of living with endometriosis and having multiple surgeries. It's so important that we spread the word and we create awareness for endometriosis so that, you know, instead of taking someone 8 years for a diagnosis, they can be diagnosed in a year. And they can be taken seriously, and we can avoid all of the mental crap that goes along with being gaslit and told that there's nothing wrong with you when you're in excruciating amounts of pain consistently. So that is why I talk about this stuff. And I know it doesn't affect everyone, but at this point in time, with the amount of people in Australia that have endometriosis, it is actually on par with those who have diabetes. So if you think about that, you know or love someone with endometriosis. And it may not be severe because it isn't always, but it might be. And it might be impacting them more than you can even imagine, because that's the thing about women. We are fantastic at putting on a brave face. We put on our makeup. We look great. You know, we look vibrant and bubbly, and we're excellent at masking. So it's really important to bring awareness to this, because it is an invisible disease, an invisible illness without a cure that is very difficult to live with, is very costly as well. There's a lot of things that go hand in hand with this. It can ruin your self-esteem because you find that you're not allowed to work as much, or you physically can't work as much as you used to work. Maybe you can't work at all. It just depends. But it's just a very complex issue that we need to put more money into, because we have a fraction of the funding that other diseases that affect the same amount of people have. So this is why I talk about it. This is why I don't shut up about my uterus and my bowels. So I hope this has been helpful. Normally I do a lot of makeup content. So if that's what you like, or if you love traveling, you're in the right place, because I'm obsessed with that as well. And I'm sort of getting into doing more vlogs lately too. But I hope that this has been helpful. Please subscribe before you leave. I'd love to have you back. And yeah, leave a comment or a little emoji. I'll be back with you again very soon right here at the Diaries. Bye.